I'm going to introduce Julie Cropper, and we'll now be hearing from the Leeds Teaching Hospital, who have been trialling using the SEREN Connect in various ways. And this is being led by Julie Cropper herself, and Julie holds qualifications in both adult and paediatric nursing, and has worked as a diabetes specialist nurse in Leeds since 1996. Focusing specifically on young people since 2012, where she championed the use of youth workers joining the team in 2013. Julie is also the lead nurse for Yorkshire and Humber Children and Young People's Diabetes Network, and is the local lead from transitional care from paediatric to adult services. And as I say, all being well, we have had the go ahead. We should be hearing from Julie from Leeds.
Hi, Jonathan. Can you hear me all right?
Perfect. Yep.
I'm just trying to put my camera on, but it doesn't seem to be working for some reason. But I've got some slides to share, so you perhaps don't need to see me. Okay, sorry, just give me a second. Can you see the slides?
Go ahead, Julie, it's fine.
Okay, thanks. Okay, so I believe you're having an interesting day. It sounds an interesting programme, so I hope you're enjoying it, and thanks for inviting me along to talk about our experience in Leeds. I've not got much to show you because I thought it'd be better to answer questions if you had any questions and that sort of thing, but I'll go through the brief things that I have got. So in Leeds, we've used the WICKED structured education scheme for a few years, which was developed in Sheffield, which I think you've perhaps heard of, which is a week-long course for young people with diabetes, but there's a lot more clinical content in than there is in SEREN Connect. So our team found that SEREN Connect was more fun and relevant without the clinical content, and the young people seemed to enjoy it a little bit better, although they did like WICKED. The team that delivered on WICKED is the same team that's delivered on SEREN Connect, apart from the dietitian, because we don't have a carb counting session in SEREN Connect. So because of capacity, we've got a couple of nurses, a couple of youth workers and a psychologist that deliver on SEREN, and not all there at the same time, depending on who we've got available. We have had difficulty recruiting to all of the structured education courses, and I think it's quite a common theme that a lot of people have an issue with this. So Sarah was recommending that you have it as part of your normal pathway, if you like. So rather than saying, would they like to join it now, we would say, which one of these sessions would you like to join? And we're trying to do it that way to see if that works any better for recruitment. And also asking the named nurse for each young person to try and recruit them specifically, rather than just the team that were delivering the content. So the people that have attended, however, it's evaluated really well, and we're trying different formats to see which works best. The young people had told the youth workers different things, different ones wanted different things. So we're trying a variety of ways. So some of them are face-to-face and some of them are virtual. We've had some weekly sessions. We're going to have some virtual monthly sessions shortly, and 2-day courses where it's all together, all the 4 sessions together. And it may be that we deliver a variety of them and give them the option, or see which works best and do that. A lot will obviously depend on staffing and time as well. We've been using the slides that Sarah developed for the virtual sessions during COVID as a prompt for the face-to-face sessions, because we'd never done this before. Some of the staff were a little bit anxious about it, and they were quite new in post, some of them. And for quite a few years now, we've done a session before young people go to university called Cook and Eat, where we help them to cook some basic meals, cheap meals that can be adapted to various different scenarios, eat that at lunchtime, and then in the afternoon we have a session about moving away from home, going to university, what's different, what sort of things they need to know, as well as sexual health, alcohol, drugs, those type of things. So what we actually did was we took the content of SEREN Connect and made that into a session for the people that were going to university this time. And that went down really well as well. That evaluated well. We found actually we tried to put a little bit much into that session, so it was a little bit rushed towards the end, but we'll look at the timings of that and adapt that accordingly for next time. So I've got some comments. This is from some of the staff. Everybody found it useful, quite comprehensive. lots of information, wide range of relevant topics and issues. It doesn't feel like a lecture. It's quite flexible and it can be adapted. So a couple of people in one of our sessions had autism, and one had learning difficulties, one had quite severe anxiety, and we could adapt it to their needs at the time. People have found to be a breath of fresh air, really useful. They like the leaflets. They are very concise and informative, so there's not too much on them. They're easy to read, and there's plenty of hints and tips in them. One of our members of the team also has diabetes and would have liked to have gone on this course if it had been available when she was of the age group that it's aimed at. It's easily accessible straight out of the box, as this person put. So because, as I say, some of them were a little bit anxious about it, I think the fact that it was so easily accessible and easy to follow, that we could deliver it without too much practicing beforehand. Our youth workers are recommending it to other youth workers across the country, so I think you might get lots of people inquiring about it. The young people on the feedback, I just pulled out some of the comments, things that they enjoyed. It was really informative. They liked the friendly team members. Someone met another person. When we'd previously done Wicked, there was a couple that met on there and they've now got engaged. So it's quite a good way of meeting people with similar interests sometimes. Although just because you've all got diabetes doesn't mean you can get on, obviously. We also had another group where they were all into Comic-Con type things, so they all made a little group afterwards with that as well. Learning new skills. They like the straight talking, not speaking like they were children. And I think possibly contrasting that with the Wicked is quite clinically orientated and was developed by, I think, children's nurses who were then working with young people. And there was some focus and input from young people, but not as much. So I think this is more young person friendly. Talking to other people in the same situation they enjoyed, and talking about stress and hearing other people have similar issues. I think the group thing is what most of them get out of any of the groups, but the content helps as well. With the stress session, we had one of our psychologists that delivered on that session as well, and I think that's been really useful for if anything crops up as well. Things that they found useful was learning about the different scenarios and how to handle them, talking about work, learning about drugs from some of them. Again, that many people have the same issues. Drinking, telling people about diabetes specifically. We used to do that anyway on the university session, but not so much about in the other sessions. And then learning how to manage diabetes in day-to-day life and being more independent and then managing diabetes at uni. Most people couldn't think of any ways to improve it. They just really enjoyed it. There was a lot of people just putting no, nothing. There was one person that didn't particularly enjoy talking about stress. And with the university session, as I say, we didn't really allow enough time for it. I think we could have done with some more time for the group discussion because that went really well. Some of the suggestions from staff. One person said they might introduce more information around a wider range of substances. So with the drugs, in the past, with that session, we've had sort of, you can get a box from the Public Health Service that's got a lot of different drugs in. Obviously, they're under glass, and I don't know if they've got actually any drug content in them, but to stimulate that sort of talk and discussion with the different types of drugs. The card matching about healthcare professional roles could be presented in a more interesting way. Just, I think we adapted how we used that one because it seemed to be a bit wordy. And we had one session where the young people had to go to different parts of the room whether they thought something was true or false. Some people were a bit self-conscious and didn't particularly like that. So another time we used the true or false card and just turned it over when they were sat in their places. So we adapted it that way. But there was one session where some people enjoyed lining up for personal traits to see where you were on a scale. So again, you can adapt it to suit the audience at the time. The people enjoyed writing on the balloons. They laughed at one of our nurses was trying to carry them all, and some of them really liked popping them afterwards, and they liked looking at how their sort of worries that they'd written on the balloons, when you pop it, it sort of shrinks up and goes into really tiny writing. And they thought that was quite funny, but also I think they liked that about it shrinking the worries and that sort of imagery as well. We'd asked if the leaflets could be in a PDF format, and we could have them electronically, because we thought that'd be quite good if they could have it on the phone and just look at it when they needed. Not all of them, they did all take the leaflets home, which was good, but not all of them will keep them to have a look at. One person said, I found some of the activities difficult to follow, particularly the health professionals section. I think that is the one about the roles of the different healthcare professionals that was in the previous comment. It would also be good to have some additional scenarios for E1S4. Because those scenarios are quite interesting, stimulated a lot of discussion. We found that really useful. So I've got some photos, but just with the format, I couldn't put them into the presentation. So I'll just try and do it this other way, if you give me a second. Okay. This is just one of our youth workers trying to take a photograph. It's not. Okay, I'll throw it this way. This is someone trying to carry all the balloons. They're piling them on. This was our psychologist giving a facilitating the discussion about who supports the young people. On the last session of the face-to-face last lot, we took them for a pizza afterwards, so that was just a picture from that. They quite enjoyed that. This was a session about going to university, and there was quite a lot of discussion about these scenarios. Oops. Some more of the balloons. Somebody's trying to pop them. And that was just using the slides. So that was just to sort of give you a flavour of that. And has anybody got any questions?
Any questions for Julie, guys? Come on, you've got to have at least hands up. One's coming away now, Julie.
Okay, thanks. I can't put my video on because it says you cannot say your video because the host has stopped it, so I'm not sure what's happened with that. Sorry.
It's fine.
Hi, I'm not. Oh, can you hear me now? I was just a quick question to see if you'd done what age group you'd done the SEREN Connect over, whether it was the same as what we're often doing over this side of the country.
We normally open it up to 16 to 25-year-olds, so it's the transition team mainly that do it, but the youth workers, our youth workers work across young adults and transition, so and our psychologists as well. So it's open to all of them, and I also do a clinic at student medical practice, and we've opened them up to them before as well. So anybody that's within 16 to 25-year-olds generally. The university one is specifically to that age group that are just about to go to university.
Thank you.
Okay.
Any more questions, guys? Well, if you don't mind, Julie, I'll ask you a question. In regards to where you delivered the training, was it on a hospital site or was it at a sort of healthcare setting?
We've done it on different sites. Oh, I've gone all together now. I don't know what's happening here. Sorry.
We can still hear you.
So we've got a centre that we use, which is in the centre of Leeds, a conference centre, and we've used that, which is a lovely centre, but it's quite expensive, and we couldn't use that for the university session. We didn't have the access to the funding for it, so we actually had that at our centre where we do our clinics and our education generally, because they're familiar with that place, even though it's not in the centre of Leeds. So we've tried different ones, really. We didn't want to have it in a clinic environment particularly because we thought it'd be nice for them to get away from it, but actually the university session worked quite well there. Well, we didn't have it when a clinic was on, though.
Excellent. And another question that I was going to ask the whole group at one point. Do you know what the normal sort of travelling distance, the people who are actually participant in the education programme itself? Do any travelling distances?
It depends, because we've got a lot of patients from Leeds, and if it was in the centre, then it's anything up to about 15-mile radius probably, but we also have a lot of extra-regional, super-regional patients that come from all over the country, so they were going to join more with the virtual sessions, really.
Thanks very much. Anybody else? It's gone magically quiet in here, Julie. Thanks ever so much for your time. I'm sure everybody else would be grateful in the sort of time that you gave, and you know, progressing all the way from Leeds all the way down here. So thanks ever so much for giving us your feedback on the SEREN
You're
Connect
welcome.
program.
I mean, if anyone's got any questions, you know, they can email me. I don't know if I put my email on there, but it's just julie.cropper@nhs.net if anyone's got any questions.
That's very kind of you. Thanks very much.
You're welcome. Good luck for the rest of the day.